Hi, my name is Jessica. I live with my husband and our 6-year-old son. He turned 6 in September. Here's a picture of him. His name is Maxon, and he is diagnosed with autism and probably ADHD. Um, with the current pandemic, we're not in any therapy, but for a while he was. I'm kind of going off the list here. So let's see. He has no siblings. We have 2 pets, a dog and a cat. And our dog is really great with him, super patient. My son has a lot of energy, and sometimes they get going together, but for the most part, they get along really well and there are no issues. My husband is 13 years older than me and likely on the spectrum as well. So I'm the only one in the house that is not on the spectrum. So at times that can be difficult for me, but we make it work. So let's see what's next. When we were in therapy, we started off early with therapy. We started in EI when he was 2. He had at that time social work, physical therapy, and OT. And then after he transitioned out of that, he continued with physical therapy and OT outside at a secondary clinic. He did really well. He loved it. We just finished only because of the pandemic. Otherwise, he would still be in physical therapy. He has low muscle tone, so he uses inserts for his feet that go in his shoes, and then he also has a compression shirt that he wears sometimes to help regulate himself as well. What's next? As far as the different medical procedures he's had, when he was born a week late, but he had a couple of things going on that had him in the NICU for a week. So he had a pneumothorax, or a tear in his lung, that occurred during birth. They were concerned about possible meconium aspiration, so they were pretty aggressive in suctioning out his airway, and so he got a little tear in his lung, and that caused him to not eat for the first few days of his life. So he was in the NICU for a week. We got him to start eating, and then we were released from the hospital. He was born around 8 pounds, I believe. It's hard to remember now. It's been 6 years. But he was a good weight. And I remember people kind of wondering what he was doing in the NICU, because he was not a small baby by any means. And then he also had a hypospadias that he needed repaired. He got that repaired around 8 months old. So that was stressful for mom to have him go under surgery at such a young age. But he did a great job, and he was able to get that repaired and prevent any future problems. As far as experiences with therapy, they've all around been really great. There have been a few things that, caused issue that I brought up. I remember when we were in EI and receiving lots of therapies, and this would apply for even if they're not in EI, but perhaps receiving multiple therapies. I had to kind of sit down with my therapists and sort of remind them that I was only one person and I could only do so many things at home and implement so many things at home. They each would give me homework, but with having 3 or 4 therapies and then having them each give you homework, it can be a lot to manage on top of your daily life. And I got to a point where I found that it was causing too much stress for me. So I had to talk to them, and they were great about listening and coming up with a solution in a way where we could still implement homework, but perhaps shuffling through each therapist each week, where I get therapy for OT that week or homework for OT that week. And then maybe the next week I would get homework for social work or physical therapy to kind of lessen the load on the parents. That was one of the major issues that I had. And other than that, I don't recall any other issues. Therapy has been really great for us. Initially, when he was diagnosed with autism, the diagnosing doctor wanted him to be in ABA therapy. But unfortunately, our insurance does not cover that. And to do it without insurance is way too expensive, unfortunately. So he was not able to receive ABA. Once the pandemic is done and we are able to go back to things being the way they were before, he'll go back to receiving physical therapy, possibly feeding therapy. He's got a very limited palate. He's not underweight, but he doesn't eat a very big variety of things. So that's something that we might be possibly going down as far as an avenue in getting him to eat some more vegetables, some more fruit, other than nuggies and grilled cheese, which both are great, I'm sure, but you need to eat more than that. So that's kind of the road that we're going to be heading down once things clear up again. Let's see what else there is. Something that's been positive with therapy has just been the therapists have all been great about working personally, and individualizing their therapy for Maxon so that he can get the most out of it. And I think that's something, that comes along with the therapist and their willingness to maybe look at different avenues or different ways of doing things. And what else? I think what's most important as a parent working with therapists is just that there's good communication and you have the ability to express your concerns or your, the positive things that happen and easily communicate them with a therapist. And I think that's probably what's most important, is just open communication. And I can't think of anything else that I would add other than, therapy has been great, and I think he's gotten a lot out of it. And once things clear up again, we will start our therapy adventures again. So thank you for taking the time to listen to our video. Bye.